Hi everyone, my name is Marty Guthmiller and I am CEO of Orange City Area Health System, bringing you today on Friday, October 23, the 66th edition of our COVID-19 community briefing. As it is our end of the week briefing, I do not have a local scoreboard, but I will be giving you some local information after we go through our statistics. So first of all, Sioux County, we've had 69 additional positives this week since Monday. We last spoke on Monday of this week. The official number today is 2,355 positives of the 9,382 tested. That is a 25.1% positivity rate, up from previous times at 24.9 and 24.6. So not the greatest news. That number is still rising a little bit from earlier this week. However, the 14-day average, much better numbers there. We are now number 6 in the state, still top 10, but working our way down at 19.1%. So we're below the 20% threshold finally. Our previous numbers were 23.2, 26.5, and 25.1. So 19.1 is a welcome number, puts us at number 6 in the state. Number 5 in the state is Plymouth County at 19.9%. They were previously 19.2. O'Brien County, number 9 at 17.4%. That's up. They were at 15.5. Lyon County's at number 14 at 14.9%. They were previously at 14.5. There were 50 counties in Iowa at 10% or more. And last time we spoke, there were 44 counties at 10% or more. Region 3, the 20 counties in Northwest Iowa, not a lot of change, no real change there. 118 hospitalized in those 20 counties, 72 of which, pretty much 72, as of yesterday, there were 72 hospitalized in Sioux City. So anyway, 118, 26 in the ICU, and that compares to 24 on Monday. 1/2 of those patients are on vents, so a fairly high number at 13. The number of patients admitted in the last 24 hours is 19. State of Iowa, 112,746 positives of the 925,332. So that is 12.2%, up again, 11.9. Previous to that, 11.7, previous to that, 11.6. So we've climbed above that 12% mark, have not been there probably before at all. Hospitalizations, we have 482 hospitalized in the state of Iowa. 11 of those, 11 residents from Sioux County are currently hospitalized. That number previously was 18, so we've had a nice drop down in that. O'Brien County 2, that number previously was 3. Lyon County 1, no change. Plymouth County 4, it's down from 6. And Woodbury County 42, and number 1 in the state. Again, that's Woodbury County residents hospitalized. The number of hospitalized COVID-19 patients in Sioux City is more like 70. But 42 of those are likely from Woodbury County. Polk County is number 2 in the state, so the county where Des Moines is at 40, number 2 in the state. They previously were at 38. So not so good numbers from the statewide basis, but actually Northwest Iowa numbers, particularly the non-Woodbury County numbers, are trending in the right way and are actually fairly decent. So there's some encouragement here. We have had 88 additional deaths in the state since Monday, and the number is 1,620. Sioux County is at 16, and that is 5 more since this Monday. And looking at the demographics, really, again, no change in those demographics. 0 to 17 years old, 0 deaths in the state. 18 to 40-year-old bracket, 1%. 41 to 60 age group, 9%. And then the 61 and over group is 89%. So that's continued very steady for a long, long time. So those are some of the stats. When we look at what's going on locally here, things are calming down a bit, knock on wood, but things are a little calmer right now in Orange City. I can't speak for the other Sioux County hospitals. We have 3 patients currently, COVID patients currently in the hospital. Landsmere Ridge, a retirement community, we've seen no new cases in the last 14 days. And so we're beginning to think about how we can open things up a little bit at Landsmere. Obviously a tough situation when you need to restrict people within their own homes, kind of a thing. But the 14-day mark has been reached and passed. And so we're going to look at how we can open up safely, but in a slow and deliberate fashion. Good news also at Prairie Ridge. We've had 0 residents test positive again this week. And as you probably know by now, we do test our residents weekly, and we test our staff members twice weekly. And so the blessing in all of this so far is we've had very little infiltration into our nursing home. And that's been a real blessing for all of us. A couple things regarding testing. Our Test Iowa site is still available. I think we might be looking at adjusting those hours. As far as I know, they're still from 7 to 9, but I think we're looking at adjusting them from 8 to 9 in the morning as our test numbers are going down and the demand for that is going down. But go to testiowa.com and you can get things, look at the Orange City site, and you can get things all lined up and get your code and then bring that in on your phone and you can get your free PCR test. Testing in general is available, more available than it has been. And so one of the reasons we're seeing more positives is we're actually doing more tests. And that's a good thing. But because we're not seeing, again, the level of acuity that is of grave concern. It's of concern, but we have to still keep this all in perspective. In the meantime, a couple things that we want to repeat. Get your flu shots. We haven't gone through a time where we've had flu and COVID, both deadly viruses. And so make sure you get your flu shots, and let's try to minimize that. Make sure you focus on your exercise and activity, particularly as we go into thinking about some snow this weekend in still October. So focus on your exercise and activity. Maybe it's going to take a little more effort to do that, but it's really important. Don't ignore the other risk factors in your life. So, make sure you get those screenings done. You eat properly, nutrition and all those kinds of things are really more important. Also, we've talked about the mental health part and how important that is, and that it's very much part of our lives and how we react to viruses and can fight things off. The newsletter for our Home Health and Hospice group is coming out, and it has an article in there that's very good, and maybe we'll post it on our website or something also. But it has to do with the power of touch. I'm very concerned about our folks in the nursing home, for example. More specifically, the isolation that we're forcing them into, because you simply cannot risk introducing the virus into that environment, because it'd be so catastrophic for them. But you also want to make sure that the cure is not worse than the disease. And so one of the things with the power of touch and the things that this article talks about is that our brains are flooded, I'm told, I'm taking this from the article, our brains are flooded with dopamine, serotonin, and oxytocin when we touch, when we feel and are with other people. These are feel-good hormones. And so what do feel-good hormones do? They make you feel better, right? And when we aren't touched, our brains suffer from a lack of these chemicals. And so the result of that, we could feel depressed, we could feel anxious, we could feel stressed. How many of us have not felt that way, right? Also, we might have some trouble sleeping. And again, the touch deals with and stimulates the vagus nerve, it's called. And the vagus nerve and how the body works is really amazing in terms of boosting our immune system. When our nervous system, through this vagus nerve, is calmed, it helps boost our immune system and can lower both our blood pressure and our heart rate, which we could probably all use, right? And so the power of touch is something that we don't want to overlook. And we're looking at ways, even in the nursing home right now, where we're going to have spouses, and as an example, wear gloves and reach through plexiglass and to hold the other spouse's hands with gloves on, simply because touch is so important. And we really wish we didn't need gloves, but we do need gloves. But I don't think that that's the important part. The important part is that they actually, the power of touch can go through that. And one of the things that social distancing has done, of course, is pull us further apart to eliminate more of the touch, the more of the being with people. And so we do need, as humans, we do need and crave physical contact, to be in the physical presence of others. And so it's really important to try to be able to do that. In addition to taking care of yourself physically, take care of yourself mentally. Now, how can you do these things? Again, I'm not an expert, but there's a couple things. And here's where I can get into trouble a little bit. And I'm not advocating hugging, but when appropriate, with your masks on and probably gloves on, take the opportunity to have an appropriate hug outside. And in the article, it talks about a 20-second hug. You don't have to time it with a stopwatch because that adds more stress to the whole equation, right? But consider that. Video calls, when all else fails, use a video call. The visual connection helps a little bit. You can cuddle with your pets. You can give your pets hugs, things like that. Sometimes that works better than others too. When appropriate and when able to be done safely, consider a massage or a manicure or even a haircut. Just the physical touch is that important. One could even consider a weighted blanket as an example. So those are just some ideas of the power of touch, the power of connectivity, and how those things all play into our physical well-being. Well, I think that's probably more than enough for me today. But I wanted to give you a little bit of an idea that things are a little bit better right now. That the mental part is as important as the physical part. Got to pay attention to both. To hang in there. We're going to get on the other side of this thing pretty soon. And I guess I just would encourage you once again to stay strong, stay vigilant, keep wearing those masks, keep social distancing, maybe sneak a hug once in a while, stay away from large groups, but pay attention to yourself, enjoy life, but stay vigilant in doing so. And above all else, again, if you do these things, you're going to stay healthy. So thanks again for joining us. We will look forward to the 67th version next week, most likely on Monday. Thank you for joining us. Thank you for the trust and confidence that you place in Orange City Area Health System. We will never take that for granted. Thank you again, and have a great weekend.